Most pregnancies go smoothly, but there are a few symptoms you should never ignore. In this video, I will tell you the danger signs in pregnancy that need urgent medical attention and what to do if you notice them. The purpose of this video is not to scare you, but to help you recognize warning signs early so that help can be given on time. The first one we'll talk about is vaginal bleeding. Ideally, there should be no bleeding at any time in pregnancy. Any bleeding, light or heavy, must be taken seriously. First trimester bleeding may be due to a threatened miscarriage or an ectopic pregnancy, which is when the fertilized egg implants outside the uterus, most commonly in the fallopian tube. This can be life-threatening if not treated early. Second trimester bleeding may indicate miscarriage or placenta problems. Third trimester bleeding may be due to preterm labor, a low-lying placenta, which we call placenta previa, or placenta abruption, where the placenta separates from the uterus too early. In case of any bleeding in pregnancy, call your doctor or go to the nearest emergency room immediately. The second one is abdominal or pelvic pain. Persistent abdominal pain in pregnancy is not normal and needs urgent evaluation. In early pregnancy, persistent pain may indicate miscarriage or ectopic pregnancy. In later pregnancy, persistent pain with or without bleeding may suggest placenta separation or preterm labor. Sometimes, miscarriage can occur without pain due to a condition called cervical incompetence, where the cervix opens painlessly. Any pelvic pressure, heaviness, or lower abdominal pain requires immediate medical evaluation. The third one is persistent or severe vomiting. Nausea and vomiting are common in pregnancy, but excessive vomiting is not normal. Seek help urgently if you vomit more than 8 to 10 times a day. You cannot keep fluids down for more than 8 hours. You cannot eat for over 24 hours. You haven't passed urine for 12 hours or more. Severe vomiting can cause dehydration and electrolyte imbalance, which is dangerous for both mother and baby. The fourth one is decreased or absent baby movements. Baby movements are a sign of good fetal health. First-time mothers usually feel baby movements by 20 weeks. In later pregnancies, movements may be felt earlier at around 18 weeks. By the third trimester, babies develop a regular movement pattern. In general, 10 movements in 2 hours is considered reassuring. What is more important than the number of movements is what is normal for your baby. A sudden decrease or absence of movement must be checked urgently. The fifth one is severe headache, blurred vision, upper abdominal pain, or sudden swelling. If you experience persistent severe headaches, blurred vision, pain in the upper abdomen, especially on the right side, or sudden swelling of the face, hands, or feet, you should contact your doctor immediately and get your blood pressure checked. These symptoms could be a sign of preeclampsia. Preeclampsia is a pregnancy-related condition characterized by high blood pressure, excess protein in the urine, and signs of organ damage, especially to the liver and the kidneys. It usually develops after 20 weeks of pregnancy. If untreated, preeclampsia can progress to eclampsia, where the mother may have seizures, dangerously high blood pressure, and serious complications affecting both mother and baby. The good news is that regular antenatal care helps detect and manage this condition early. The sixth one is severe itching, especially on the palms and soles. Some itching in pregnancy is normal due to hormonal changes and skin stretching. Certain pregnancy-related rashes can also occur, such as pruritic urticaria papules and plagues of pregnancy, which causes itchy rashes around stretch marks. Another one is prurigo of pregnancy, which causes small itchy bumps. These are uncomfortable but harmless. However, intense itching without a rash, especially on the palms of the hands and soles of the feet, may indicate a serious condition called intrahepatic cholestasis of pregnancy. This condition occurs when bile acid builds up in the blood and deposits in the skin, causing severe itching. This condition can increase the risk of preterm labor, fetal distress, or stillbirth in severe cases. If you notice this type of itching, inform your doctor immediately. The seventh one is foul smelling or abnormal vaginal discharge. Vaginal discharge normally increases in pregnancy due to hormonal changes. Normal pregnancy discharge is clear or milky, odorless or mildly smelling. Abnormal discharge includes foul-smelling discharge, green or yellow discharge, cloudy white discharge, or a blood-stained discharge. These may indicate a vaginal infection. Vaginal infections are important to treat because they can lead to preterm labor. The eighth one is watery discharge from the vagina. If you suddenly feel a gush or continuous leakage of watery fluid from the vagina, your water may have broken. If you are unsure whether it is urine or amniotic fluid, go and urinate to empty your bladder and observe if the fluid leakage continues. If it does, assume your water have broken and go to the hospital immediately. The ninth one is fever. Fever in pregnancy should never be ignored. It may result from infections ranging from mild to serious, but fever itself can trigger preterm labor. You may take paracetamol to reduce fever and drink plenty of fluids. Avoid drugs like aspirin and ibuprofen. Always consult your doctor if you develop a fever during pregnancy. The 10th one is sudden or severe difficulty in breathing. Mild shortness of breath can be normal in later pregnancy because the growing uterus pushes the diaphragm upward. However, sudden or severe breathing difficulty may indicate severe anemia, asthma attack, pneumonia, or pulmonary embolism, which is a blood clot in the lungs. Seek urgent care if you have rapid breathing, chest pain, fever, cough, palpitations, or fast heart rate. Finally, the purpose of this video is not to frighten you, but to help you recognize symptoms that need urgent attention. Be aware, vigilant, but also remember to enjoy this special journey. If you found this video helpful, please like, share, and subscribe to the channel. And until next time, stay healthy and be kind to yourself.